right, good morning, students. We are going to start off today's 103-2 lecture with our Chapter 2 PowerPoint. And Chapter 2 is based off of office procedures and client relations. Now, you will notice that your homework is staying the same. So you are still doing your homework with Chapter 4, that has to deal with animal behavior and training and all of that. But just for lecture wise, because we're going over office procedures and with examination room procedures, this is why I wanted to implement this into our PowerPoint schedule for the module. So again, your homework is still in Chapter 4, but we're just expanding our knowledge a little bit and going off into another chapter to get into those exam room procedures. So we will get into a little bit, kind of diving into reception duties, because it does go into a lot of what we do when we're talking with clients, educating clients, admitting and discharging clients and patients. So a lot of what we do, yes, we work with animals, but gosh, we talk with people all the time. And if we don't have that good communication with our pet owners, we aren't going to be able to do anything medically for that pet. So really important. We're going to be going over what is consent, especially informed consent. What's the difference between the two? And also making up discharge instructions. How do we do that? How do we present that to the client? There are effective and different professional discharge sheets, and your clinic will have whatever is specific to them. Sometimes it's just a fill in the blank and you just kind of check off what you need for that type of a patient. And they'll have it for different surgical procedures or reasons for being in the hospital. So we'll have, you know, a spay to go home sheet, a neuter to go home sheet, mass removal, hospitalization, etc. So choosing the correct one and then just checking off exact instructions that they need to know, because not every patient will be the same, even if they're hospitalized or have had the same surgery. We might need to add in additional notes and going forward. And we'll always give the owner a copy of these discharge sheets. So yes, we're going to be telling them, we'll be giving them discharge instructions, and then we'll give them a actual hard copy of the discharge instructions, because what we tell them, probably a good chunk of it, half of it is going to go right over their heads. And that's okay. A lot's going on. We also need to know, how do we properly educate these clients? It's a huge part of our job, is educating people. So many people don't know about basic animal medicine, and that's okay. It's our job to swoop on in, save the day, let them know what they need to do, and help them feel comfortable and confident with continuing on with treatments and what to do for their patient moving forward. Now, one of my favorite parts about talking with people about is health insurance for their pet. What are the best companies to go to? What are the good benefits? How can they help them moving forward? Insurance is wonderful. I have it on my own cat, and it's that peace of mind that just in case anything were to happen, I know that I can afford it. She's going to be okay. And I wouldn't have to be in a devastating position, which unfortunately you will see people in a position where they can't pay for treatments, and there's not much that we can do. You know, if they're not approved for loans and credit and things like that, the help of insurance is tremendous. So always being advocates for that. You guys will talk a lot about it with your clients. And usually at hospitals, it'll be a part of your employee contract where you can get it for your own pets for a reduced rate, or they'll pay it out for you. Definitely a huge perk about being in the field. We're also going to go over different medical records, how to identify your complete medical records, kind of getting back into that SOAP, that subjective, objective assessment and plan, how we're going to be making that, and also using POM-R, that problem-oriented medical record, again, with using our SOAP formats. Continuing on with the learning objectives, we're also going to go over how do we take inventory and how do we maintain our inventory logs. This is extremely important to be accurate and efficient when doing so. And usually every hospital will have one designated technician or receptionist or both to be in charge of inventory. They'll go through all of the hospital's inventory at least once a month and be doing ordering moving forward. We'll also talk about phone techniques. How do we answer the phone properly? How do we put somebody on hold properly? What is good phone etiquette for the veterinary hospital? As assistants, we'll have to jump in from time to time to answer phones, to help put people on hold, schedule appointments, or even do callbacks, calling back those surgical patients, calling back those hospitalized patients, checking in, seeing how they're doing. It's not like once they leave the hospital, we don't care anymore. We do at least 2 to 3 follow-up calls on those surgical and those hospitalized patients. We want to make sure that they're being managed well at home. Unfortunately, people tend to, if something goes wrong, I don't know why it's like they're more apt to not say something and not call us back. When in reality, if sutures fall out, if something happens, we're that first line of defense to help them, have them come in, help readjust and fix the problem. So always, we have to unfortunately be those ones that usually reach out to them, and we'll do multiple phone calls. Now, with the phones in the veterinary hospital, you might have 5 to 10 phones throughout the entire hospital. It's all through the same number, and there's multiple phone lines. Usually there's like at least 4, if not more, which means that multiple people can call. We can put multiple people on hold, and you can also pick up that phone call from any phone within the hospital. So it's pretty cool. They're all interconnected. We'll also go over, of course, how do we greet our clients? How do we approach them and talk with them? Because even though we're dealing with the animals, huge part of our job is communicating with these clients. And looking at the different forms at the end of the lecture, I have quite a few different forms we'll take a look at that are used in the veterinary practice. They're just example forms, but forms that you will run into all the time. We definitely do a lot of paperwork. So getting into front office procedures, and our first topic is going to be telephone etiquette. I know a lot of people get really nervous on the phone. They're not too comfortable with the phone yet. So just definitely keep that in mind for moving forward into your assistant position, as you are expected to help with answering the phones. No, you're not a receptionist, but we need to be able to answer the phone call, either place them on hold or help schedule an appointment, or again, doing a callback. So it's something that you will become more comfortable with over time. Yes. And then absolutely be touching on that customer service voice. I don't know if you guys have ever worked in customer service before or had to answer phones at a previous job. You might have a certain telephone voice. I know that definitely I have one, of course, when I'm answering a phone call. I kind of have that. It's definitely like a telephone voice. So if I were to answer a phone call, big things that I need to do is I need to be, of course, aware of the tone of voice, and I need to be introducing myself and my hospital appropriately. So I always want to say a greeting, whether that's good morning, good evening, good afternoon, hello, whatever works best for you. Where they're calling, I always like to say, good morning, Paradise Cat Care. That's the last cat clinic I worked for. My name is Shayna. So introducing myself, my name is Shayna, and how can I help you today? I can also add in, if I need to put them on hold, thank you for calling Paradise Cat Care. If this is not an emergency, may I please place you on hold? That's really important. You always have to ask if there's an active emergency going on, because if they have, an animal that was just hit by a car or some traumatic event, they're having a seizure, we don't want to just pick it up and place them on hold. That's a really bad taste in someone's mouth that you're leaving. So we want to, of course, address them immediately, telling them to come in or recommending an emergency place that they can go to, and then we can continue on with what we're doing. Now, verbal skills are important, and don't worry, you will learn this over time. Just certain things to say, ways to go around it. And if all else fails, if your customer is not happy or they're upset for whatever reason, place them on a hold and find somebody that can help them. Find an experienced receptionist or your manager. Definitely don't stay on the phone when you can't give answers. It's okay to say, that's a great question, or I would love to help you. Let me place you on a brief hold while I find somebody that can help schedule you with what you need or can help assist you in that way. So you will learn different, we call it sound bites. So different little bits and pieces of information that you will share and say in certain situations to help you get through these phone calls. For the most part, you guys, people are calling for, medication refills, scheduling appointments. Majority of the calls are fairly easy. Of course, we get a handful of emergencies or more urgent situations, and you'll graduate to becoming better at those phone calls. Again, if worst comes to worst, place them on a hold and get somebody more experienced that can help with the phone call. Now, it's really important As assistants, we can't diagnose over the telephone. So they can tell us, the patient looks like they have this big red spot on their back. They're itching and licking a lot. What do you think it could be? Well, I could think a lot of things. I could think that it could be a hot spot. It could be ringworm. It could be just alopecia or hair loss. It could be an allergic reaction. It could be so many different things. But guess what? I'm not a doctor. I am not allowed to diagnose, period. Whether that's over the phone or in the clinic, I can give my opinion and I can talk to other technicians and doctors about that, but I can't tell the client what I think it is. That's diagnosing, and I don't have the power to do that. So just be aware with your words, you guys. You're not allowed to tell somebody, I think it's this or I think it's that. You can let them know that sounds like a severe skin problem. I believe that we should schedule them for an appointment immediately. If they question why, what do you think's going on? You can say, I'm not sure, but with those symptoms, it looks like we may need to do certain treatments. They might want to do antibiotics. We're not exactly sure until we see it, but it's a good idea to schedule an appointment. So really try to push for that scheduling rather than giving out all this free advice or illegal advice. Be really careful, be really, really careful, you guys, with what you share over the phone. It is a legality issue. If you tell somebody that their dog has a hot spot, you've never seen this dog in your life. You tell them that you think they have a hot spot and they go out and they buy tea tree oil because you told them that helps with that, and all of a sudden the patient has has a huge allergic reaction to the tea tree oil, whatever that they gave them. They had a seizure and then they die. You guys, this stuff happens. Then guess what? They're going to be crawling back to that hospital and slapping you and that hospital with a huge lawsuit. You can get your license and certificates pulled away. It's really, really serious. So again, be as polite as possible. Don't be a doctor because you're not one. We don't get paid enough to diagnose and deal with all the stuff that goes with that. So try to push for scheduling that appointment and leave that up to the doctor. Don't do it yourself. You'll get yourself stuck in a really sticky situation. I've never been in a situation like that, but I have seen it happen to other people. And people are in this world nowadays are nasty and they're cold and they will sue over anything and everything, and don't for a second believe that they won't. So just kind of my little piece of knowledge to you. And something also to be aware of is people love to do what's called price shopping. So let's say they were given an estimate for a dental procedure. You guys, dental procedures can be very expensive, especially if we have to pull a lot of teeth, which for the most part, by the time the owner is paying for a dental, they're usually pretty severe. Teeth that are falling out, or we have to pull quite a few, maybe infected mouth, peritonitis can be going on. So a lot can be going on within and for that procedure. So we could quote somebody, let's say $1,200. Okay, $1,200. Somebody could look at that and go, oh my gosh, that is way too expensive. There's no way. So then what that owner might try to do is call around to different clinics asking, how much do you charge for this kind of a procedure? It's really important to note, especially with dentals, you guys, it depends on the severity. A standard dental scaling and cleaning, no scale, clean, polish, no tooth extraction, that could be $400. If the teeth are rotting out and there's gum disease and everything else is going on, expect upwards of $2,000. So huge difference depending on what's going on. So we have to be aware, if people are shopping for prices, not to give them super lowballed price, because then they're going to try to want to book and that might not actually be the price. So if they are price shopping for something like that, always go on the high end, or let them know we can't give you an estimate until you come in for an appointment. If it's a spay or neuter, that's a little different. Those are going to be standard prices, or vaccines, standard prices right across the board. But for more intricate procedures, such as the dentals, which can be anywhere from normal to severe, that's something that we have to see them first. Okay, getting into scheduling appointments. So we will be scheduling appointments, of course, all the time. Mostly our receptionists will do this, but we also, as assistants, will help getting into reception duties as well as follow-up calls. Now, with scheduling appointments, most clinics nowadays have a completely digital computerized system. Very few have paper charts still. Some do, but for the most part, it's all electronic, or it's half paper, half electronic for scheduling and invoicing reasons. So what we want to do ideally is we want to maximize our production and minimize client wait time. So we have to rationalize how long should these appointments be. And this is all going to be based off of the reason for the appointment. Why are they coming in? So a brand new first puppy, first kitten exam should be at least an hour versus where a vaccine, just a quick little checkup, that could be a 15 or even a 30-minute appointment, depending on the doctor. If they're coming in for OFA, for hip x-rays, for breeding and things like that, that needs to be an hour or more. So reception will have usually like a little cheat sheet to go off of how long every procedure should be, and depending on the doctor. And if worst comes to worst, just ask the doctor, how much time do you think you're going to need? Because the last thing we want to do is schedule them for not enough time, have the appointment go over. It causes all the rest of the appointments being late for the day. People are then unhappy. It's just going to turn into not a fun day for us. So we always want to make sure that we have the appropriate time that needed. Now, we will send the owners reminders for the appointment. Usually this is in the form of a phone call, and some clinics are getting really tech savvy and they're sending it in text messages, which is really cool. My last clinic had that. We could send it directly from the computer. If we had the owner's cell phone number in there, press of 2 buttons and boom, we got a text message sent to them. Hey, just reminding you, Fluffy has an appointment tomorrow at 2:30 p.m. Now we also will follow up with appointments, and there are follow-up appointments too. So they could be coming in for a recheck appointment, or following up could also mean we're going to follow up with them after their initial appointment, which is something that assistants will do. We'll call them back the next day, especially if they got vaccines or something. How are they doing after the vaccine? Any reactions? Are they doing okay? Some owners don't really understand the symptoms that their patient are having and how it can actually be a reaction to a treatment that they've been given. So again, big part of client education there. And most digital systems will have a reminder and recall system set in place. So like after or once an appointment's scheduled, it'll automatically remind us to remind them, the day before, or again, the system will remind us to call them the day after. When greeting clients, it's really important. You can see this receptionist, super smiley, happy, willing to help this client here. This client's in a nice, happy mood as well. We want to be as happy-go-lucky as can be. One of the hardest parts of being a receptionist is you can see really, awful, traumatic things coming through the door, emergency situations, and you got to reset because the next client coming in has a brand new puppy, and they don't need to know that you just saw a hit by car dog go through the lobby. We have to really be in control of our emotions. And that might mean that you have to step aside for a moment before you can properly greet somebody or come back into it. It's okay to take your time, but just be aware, we don't want to drag that attitude throughout the whole day. You don't want to do that to yourself, and your other clients don't deserve it either, especially if they're coming in for more happy reasons. So greeting those clients as soon as they walk through the door, you guys, it's not like they walk through and we don't say anything. We will greet them every single time, hello, welcome, what's the reason coming in today? Or hopefully you can look at your scheduler and try to figure out who they are, what patient that they have with them, so that you can greet them by name. And this is going to be the receptionist. They're the front line of the hospital. They're the first people that they will have contact with, and the last when they're invoicing out. And it is important that the lobby is clean at all times. It needs to be clean and free from odors, needs to be tidy and neat. Of course, accidents are going to happen. Pets have accidents, and that's okay. We want to make sure that we mop and clean the area up as soon as possible. And we'll have diffusers running in the office too. But we do want it to be, again, it's that face, it's the front of the hospital. It's what people see when they first come in. So we want to give them that really good first impression, making sure that it's nice and clean for them. Okay, getting into some different forms here. We've got quite a few different forms, and at the end of the lecture, I'm actually going to show you guys these forms, not for today, but for our next lecture together. I have a whole list of forms at the end of the module we'll take a look at. And from what I hear, you guys are already starting to go through forms like this in your labs, which is awesome. So going through these forms that we have listed here, there's a general information form, which is talking about the client. We need the client's general information. We need to know the contact information, phone number, email, address, driver's license number, if they are getting controlled substances filled in the hospital. Patient history form. So if they're transferring with their patient, any history that they have previously from another hospital, old records will be included in this. Release forms, this is for surgery, boarding, medication, and it also ties into consent forms as well. Making sure that we have informed consent. We need to make sure that these owners know exactly what we're saying, that they feel confident in the instructions that we're giving them, and that they are actually giving us consent for these procedures. We don't just want to hand them a form and think that they can fill it out on their own. We should be walking them through. That is what's considered to be informed consent. We also have blanket consent forms, euthanasia forms. So before we go through euthanasia, we have to have these forms signed off by the owners saying that they are electing for the procedure today and what they would like to do with the remains of the patient. In the hospital, we can either give them the remains back if they intend to bury on their own property, and that's legal in that region that they live. Or we can opt to do a cremation. So we can keep the patient. We have freezers usually that we'll put them into, and then the people that work at the crematory will come by, depending on how busy your clinic is. It could be every day, it could be every week, to pick up and then cremate. And then they'll also bring back the ashes of the patients that they cremated if they opt for a private cremation. So few different things we have to get signed off there. We will never euthanize until we have everything signed off on and ready to go. Again, we don't want to get stuck in a sticky situation with that. Rabies certificates, when your patient is vaccinated for rabies, they will get a rabies tag to put on their collar, and they will also get a certificate that's signed by the doctor. And this will let us know how many years it's good for, where the location of the vaccine was given, the type of vaccine, the lot number, everything that you would really need to know. Then health certificates, the last form that's on here. A health certificate is if you are intending to travel with your patient, whether this is by car or by plane or by boat, you will need to have a health certificate done for your patient. And it's basically saying that they are in the clear, they have a clean bill of health, they're fully vaccinated, and they're ready to travel. And this has to be done 10 days prior to the start travel date. So if I wanted to fly on the airplane, like I did with my cat when I left Hawaii, I had her health certificate done probably 3 days before we flew out. And so again, it's only good for 10 days once it's done. So I had to make sure that it was in that close proximity within my travel date. That also means if you're gone for more than 10 days, let's say you get a health certificate and you fly out that day, if you're intending on flying back with your patient, if they're, if your cat or your dog's going on a trip with you, this also means service animals, they have to have these health certificates too. It has to be within that 10-day time frame, or they're going to have to go see another vet and get another one in order to return. It has to be current within those 10 days. There's no ifs, ands, or buts. Even if it's a service animal, we still need that clean bill of health, that health certificate. And again, it's only good for 10 days. Okay, getting into client invoices. These are basically it's a receipt that we're giving our client to let them know all of the procedures that we've done on the patient, and it's going to be a detailed invoice. So it'll tell them exactly what we've done and the prices to reflect that. We will usually give our clients estimates before we go into actually doing these procedures for the patients. We have to get a sign off on the estimate that they can pay, and then we'll go on forward with the treatments. We never just want to do all the treatments and then be like, okay, here's your bill, smack it with $800. No one's ever going to react well to that. So we always give them an estimate, they'll sign off on it and let us know what they would like us to do. And then once we're finished, we'll give them that detailed invoice. They'll select their payment method. We usually accept anywhere from debit, credit, check, and cash. We will have monthly statements that will come out. So if this client is a frequent flyer, if they have patients that are frequently in and out of our hospital, we may be billing them on a monthly basis if that's set up and planned. Again, these clients are usually known as like VIP clients, where they have a really good rapport with the clinic and they're okay with them paying when they're able to or on a monthly basis. Now, if it gets to the point where we're sending these bills and the owners aren't paying for it, there's an outstanding debt, it can actually go to collections, which is something you never want to happen to yourself. It'll absolutely ruin your credit to have a bill go to a collection agency. So we can turn them over to them if we need to. It can also be something where they take you to court. We can take clients to small claims court over the outstanding debts to be able to be ensured that we're going to get paid. Which is a big reason why if you ever go in, oh, sorry guys, if you ever go into a clinic and it'll say payment is due when services are rendered, that means that you pay today, you don't leave with a bill, because people will leave and never pay. Unfortunately, I wish that the world wasn't like that, but it is. People struggle financially and they will, you know, I'll pay, and then they never do. So that's a big reason why clinics usually don't do monthly payments or any type of a payment plan with clients, because it just takes one bad client to ruin it for everybody else. So for the most part, they'll tell you you need to take out a loan or go through a credit agency to pay for it. We don't usually take payment plans, again, unless it's like a VIP client. They have a million patients. We see them all the time, you know, and they make payments. They have that good report. All right, getting into managing and processing mail. This is a big part of reception duties, and you know, assistants could help out with this as well. We will be getting tons of mail that's delivered to the clinic, and this is including like lab reports from the laboratories. It could be magazines and journals for veterinary medicine, and continuing education brochures and information for that. So we will need to sort the mail, give it to who it is intended for. And then our managers of the clinic will post up continuing education opportunities and things like that on the general board, or give them out to employees if they need to go do their continuing education. As assistants, you don't have to worry. We don't have to do CEs to keep our license valid, but for technicians and the nurses, essentially technicians, they have to do continuing education to keep their license valid. They have to do like 20 credits a year or something like that. Same with the veterinarians. So we do have to make sure that we're informing everybody about that. Most continuing education is free, unless it's going to a big seminar or convention where you have to pay entries for it. For the most part, it's free to attend. They're like online seminars and meetings and stuff. Okay. The office visit. This is where we're going to play a big role in the office visit itself. As an assistant, we are going to be, if you are working in rooms, if you're a room tech, you will be there from the start to the finish of every room and continuing on throughout your day. So getting into our main points for that office visit, of course, is that greeting. Very important to greet our clients, and greeting them on a first name basis. So I would greet the pet and the owner. If I can't pronounce the owner's first name, just say them by their last name if you can. But knowing who your patient is, I never just want to walk into a waiting room and go, Gus, who has Gus? No, I want to look at the information that's on my computer. Gus is a Great Dane. Boom, easy. Now I can look into the lobby. There's probably only one Great Dane. And now I know that's immediately Gus. I can go up to that owner. Hi, is this Gus? Hi, Mrs. Robinson. My name is Miss Nielson. I'll be your technician today. I'm going to take you back into the room to start the examination process. Very nice and easy, simple. And then we'll lead them into their room. During that office visit, education is huge. They come in to get educated. We will be educating our clients. So will our doctors, but for the most part, they'll give us literature or medications that we'll go over with the client at the end of the visit, and helping them move forward. We'll also send reminders or set reminders in our system if we need to during the office visit, you know, set a reminder for a call back in 2 days. If we have to admit the patient into the hospital, let's say that they come in for an office visit and they are very, very sick. This happens to the point where we don't want to send them back home. And the doctor is going to suggest that they are hospitalized. They either stay at our hospital or they go to another one that, you know, is more and better equipped to house overnight patient. And some general practices, you guys, won't do overnights. Like they won't have any overnight staff that's on staff. It's not safe to have the patient in the clinic from 5 p.m. to 8 a.m. by themselves. So they might refer it to a hospital that's more 24 hours. But we are responsible for hospital admissions. So if this appointment turns into now a hospital patient, I would be responsible for making up all of those hospital treatment sheets and getting all the medications listed on there, teaming up with the doctor. That's going to take my full attention to do this. And then when the time comes, I will also be the one discharging these patients. So the veterinarian will write out a written or printed instructions for them. And we'll also have client education handouts that will give them to help with that treatment process, continuing on treatments at home, what to expect, and setting those reminders and follow-up appointment dates as well. So a lot ties into our, just dealing with the appointment flow, the office visit itself. One of my favorite parts working in general practice was actually dealing with hospitalized patients, admitting and discharging patients. I loved working in ICU with critical care. Rooms were okay for me. I did like getting to meet new people and seeing healthy puppies and things like that. But I really I just enjoyed having that bond with a patient that you could make over the week while they're at the hospital. You talk with their owners every day, you make a bond with their owners, you make a bond with that patient. It's really special. And it makes you feel just so incredible when they can be discharged, when they're healthy enough to go home. Oh my goodness. If I was to ever go back into general practice, they would have to be working with those ICU patients. It's so, such a forgiving and, just rewarding experience to work with in hospital patients. Now, there are different protocols that we're going to have for the hospital and for boarding. If your hospital offers boarding, which means if an owner goes on vacation and they're leaving their pets within our care for the next week or whatnot. Now, people do board patients that are more medically inclined, that are diabetic or have to have daily medications. They're more apt to board at a veterinary clinic versus your happy-go-lucky dogs and cats that don't need any meds or any special attention that way. But we do get boarding patients that are totally healthy and their owners just don't have anybody to watch them, and it's easier for them to come to the hospital. And again, whenever we are discharging patients, whenever we're going through this information with the owner, I'm going to go through the sheets with them. This written instruction, I'm going to go through it. Oh, sorry guys. I'm going to go through it with the owner, make sure that they comprehend and understand it. And then I'll give them that copy as well as the invoice to go home. This ties into having those discharge sheets that we're going to be giving to our clients. So this is those written instructions. They can be typed or handwritten for the client to follow as they bring their patient home. So we will also attach the invoice to this, and it's going to be a fully detailed invoice and discharge instructions that the client will have access to before and while they're being discharged. Now, these discharge instructions, they're going to include a lot of information. We're talking about restrictions mostly. So recommended restrictions for things like food, activity, or even therapy that they need to be doing. For example, when our surgical patients go home for the day, if they're just, came in for a spay procedure, we did the procedure, they're going to go home that day. It's an in and out type of a procedure. We would let them know restrictions for food. They can only feed half the amount for dinner tonight because they went through anesthesia. And if they eat too much, they can vomit. They also need to limit the activity because they have a big abdominal incision. No jumping, no running and playing. Try to keep them calm and in a crate, very low activity level. And therapy, it might be, cold laser therapy twice a week for the incision until it heals. It just kind of depends on what's going on there. But it's going to be a full list for them to reference and go off of. And, to be warned, if they don't follow these discharge instructions as clear as they can, as well as they can, we can see adverse effects happen because of that. We can see patients that get sick or rip out their stitches, or just bad side effects can happen. So we really try to, I even highlight these discharge sheets. Like, I'll highlight the parts that are super important. Like, please read this. Please don't have your dog jump up on the couch. I don't want to see them coming in with their guts spilling out because their incision ripped. And it does happen. So I really try to highlight that attention to me, for these things, especially for the restrictions for the patients. And tying into that informed consent, we need to make sure that the clients are understanding this information, that they're not just, oh yeah, okay. And then they're going to go home and freak out because they have no idea what to do. I want to walk them through step by step, asking them if they have any questions. We might even do a medication demonstration. So I might take the oral medication that's going home with them and show them how to pill their pet or show them the pill pockets. I want to get them as set up as possible so that they don't feel like they're going to go home and freak out because it can be a lot for people. You have to remember, you guys, general public, they don't know about veterinary medicine. We do because we're the professionals. So really important to keep your patience, keep your cool. It's okay if you need to repeat yourself, do a few demonstrations. Sometimes owners need that extra hand holding, but it'll pay off in the long run. They're going to be able to go home and feel comfortable with what they're doing. I would much rather have that than have them go home, freak out, try to call the clinic. What if the clinic's closed and then they write us a horrible review and it turns into this big nasty thing that didn't need to be there. So just take the extra time to inform them, present them, take the time to make sure that they understand the information. So this is an example of a discharge sheet. So as you can see, this is like a general sheet. So we're going to cross off which ones apply to this patient. So I could use it for a multitude of different reasons, depending on why we're discharging them. So for example, for the diet, it says, do I need to wait? Can we feed my pet normally? Is there special diet instructions? Or what about the activity? Do they need to restrict exercise for a day or maybe even 7 days? And that also includes bathing too. Post-surgical, they shouldn't be bathing their pets for at least a week. And then, other information, if there is something with the paws, especially our kitty cats, if they had a toenail that was ingrown and we had to remove it and we put a bandage on their paw, we might instruct them to use like strips of paper or some type of other kitty litter in place of their normal ones. We might need to remind them for vaccines or things like that. This last one here, your pet's metabolism may permanently decrease after surgery. You may need to decrease the amount of food or feed that you feed in order to prevent obesity. The surgery that I'm referring to here is a spay procedure or a neuter procedure. You guys, when we remove the ovaries and the uterus, as well as when we remove the testes from the males, we are causing a huge depletion of hormones to happen within their body. It's going to happen because we removed these reproduction organs. And when that does happen, that decrease in those hormones, it can absolutely affect their metabolism. I have seen it so many times where after a spay procedure, female dogs gain a ton of weight because the owners don't back down on the food. And it can cause them to become obese at a young age. So this is actually a really, really important part. And it's only really applying to the spay and neuter procedures because we're messing with their hormones. Their metabolism will never be the same. And that's not a bad thing. It's just something that we have to be aware about so that we make sure that we're not overfeeding them. Of course, with the incision, if they've had a surgical incision, where the e-collar, that cone, they might need to ice the incision. If this was an orthopedic procedure, so it was done on the bones, they might need to ice this incision. And then if there's medication they need to give, pain meds, antibiotics, maybe some other muscle relaxers or nerve blocker medications, and when to start them is very important. We usually will do the first dose in the clinic so that they don't have to worry about it when they get home. And that's where we will do the medication demo. So we'll show them how to give the meds in the hospital. And we're like, that's your first dose. So nothing else is due until tomorrow. And usually the owners are super relieved when they hear that. Now, we will have follow-up visits for our surgical patients. We want to recheck them in 7 to 14 days. That's going to be our recheck time for these follow-up visits for them. Some surgical surgeons won't use any suture that has to be removed. So this is really common in like shelter medicine or even ambulatory medicine, where they're going to use suture that will just dissolve. It's an absorbable suture. So they don't need to come in to have it removed because it's naturally going to absorb. It takes like 4 to 6 months to absorb, but it will eventually absorb. And that's where it would be, not necessary unless there's a problem. And then everyone will sign off on the bottom for that once we've read through it all and everybody feels as if they have that full information and consent going on. And again, this is just an example. So if you're on the computer, you might be able to delete the parts that you don't need and just leave what applies to them on there. This is like one that's already printed out and you would just check it off over here on the side. Okay, getting into health insurance. I love talking about pet insurance because it's helped me and my family out tremendously in our lives with pets. Health insurance for pets is very different from insurance for yourself. Pet insurance, we recommend people get insurance on their animals when they are young, within their first year of age. If you wait until they're older and they've had health conditions, it is more expensive. It's not that it's not an option. You might just be paying a lot more money. So there is variations in policies, and these policies will reflect on a few things. What are you trying to get covered? Is this more for emergency only? Is it that you want it to cover regular exams and wellness appointments? Do you want it to cover, therapy and integrative medicine, holistic medicine? So there's a lot of different variations and packages that you can buy onto your policy. And there's quite a few companies that are out there right now. And I'm going to type a few of those in the chat for you guys, just to show you guys a few. Come on, Zoom. Where's my little chat guy? Here we go. So the one that I actually use for Lilo, who's my kitty cat, it's a newer insurance company. So I use Lemonade. And again, it's only for dogs and cats. It's a newer insurance company. They're just kind of like up and coming, really great rates. And I was actually able to get like her wellness visit and her vaccines covered. There's also another really good one that I've used before as well. My mom used this on her dog, is Trupanion. Trupanion can be great, and they also work with a lot of VCAs and hospitals to where they'll pay the hospital directly, which is really awesome. You don't even have to pay out of pocket for it. Nationwide also has pet insurance policies. Embrace is another common pet insurance company. I might think of some more, but those are kind of my top 4 that I can think of at the moment. And again, most of them are for like extenuating circumstances, so emergency. And for the most part, insurance will cover 90% of costs with a deductible. And the deductible will depend on you. So for Lilo, her deductible is, I believe it's like $200. But if I wanted a higher deductible, like $500, I could make my payments on a lower basis for monthly. It just kind of depends. Sometimes they'll have copays, so you pay a certain amount every time you go in. So that's just something to be aware of. You may have to pay a deductible, but then they'll pay, 90% of all costs that are accrued, which is pretty good. It's pretty great. And one thing to note, the one downside of pet health insurance is they do not cover pre-existing conditions. So if your patient got diagnosed with parvo, and then you go to a vet office or a pet insurance company and try to get insurance, they will cover everything except for parvo because you're already coming to them pre-diagnosed. So that's the really, really crummy part about pet insurance. You have to have it before the bad things go happen, which is why we recommend owners getting it for their patients as soon as possible. When they're puppies and kittens, it's going to be the best time to get it. There's no pre-existing conditions, and then therefore everything moving forward should be covered by the insurance. Now, there are exclusions. I know that for like Trupanion, if you don't have a certain package added onto your policy and your dog becomes pregnant, they don't cover any of the pregnancy related ultrasounds, x-rays, or assistance needed for that, or the puppies. So you have to be really careful with who you sign up with and what packages you have on there. Again, I paid a little extra on Lemonade to have her wellness exam, vaccines, and preventatives covered through health insurance, which was great for me, because then I didn't even have to worry about that. But it was more expensive to do that, and not every pet insurance will cover wellness visits. It's actually very rare. Lemonade was like one of the first that I ever saw do that. So just be aware of that, you guys. There are exclusions. They will try to get you in certain places, but it can be wonderful to have this as a good backup in case anything goes wrong, because then you're not slapped with a huge medical bill. The one catch for pet insurance is the owners pay first, then they are reimbursed by the company. So I would have to pay out of pocket for so like I took Lilo in like a month ago and got her vaccines and exam done and everything, and I paid, it was like $200 some because we refilled her flea medication and things like that. And so I paid out of pocket, and then I had to go onto my insurance company website, submit the detailed invoice, and I got my money back actually that same day. They reimbursed me that same day. It was super quick. Sometimes it takes longer. So just be aware, it's not like regular animal, human insurance where you can go in and they just bill the insurance. It's different. You have to pay first, and then the insurance will reimburse you. Trupanion is the only one that's kind of gotten around that because they've set up, it's like direct pay with certain hospitals. You have to have that, make sure that you call them ahead of time and know that they have it. That happened with my mom. Her Blue Healer had to get a patellar repair surgery, so repair on her knees. And it was like a $4,000 procedure, and they had Trupanion for their dog. I encouraged them to get insurance on her, and the insurance actually teamed up with the hospital and they paid them direct. So my mom didn't have to pay and then wait to get it reimbursed. They actually paid the hospital direct, and then she just paid the 10% that wasn't covered. So I think overall she paid like $200, and it was a $4,000 procedure. So pretty incredible, pretty awesome. I love insurance. I'm hoping that it'll get better in the future to where we don't have to wait for reimbursement and things like that, because that's still an issue for certain people. Hopefully that'll get better with time moving forward. But we're big advocates for health insurance, you guys. It saves so much for people. Man, I can't tell you how much it's done for me and my family and my pets, and I'm just very thankful for it. So I highly recommend it. Please, if you guys have any questions about insurance, please feel free to ask me, send me a message about it later. Even if you're curious, I will absolutely help you get started with that. Also, I apologize. They are doing some yard work outside of my apartment, and I'm really sorry if you guys can hear it. Hopefully that'll be over with soon. And actually, guys, we're going to take a little break because it is right around the hour. It's almost 10 a.m. All right, everybody, we're going to pick up where we left off. So last time before our break, we were looking at pet health insurance. So now we're going to get back into it, looking at medical records. And it's really important to know that these medical records, even though they are for an animal, you guys, they're for somebody's pet, they're for an animal, we have to treat them just like we would with human medical records, which means these are legal documents. They are property of the practice. So that means they are legally owned by that veterinary practice, and they can be brought into court. Unfortunately, there are situations where lawsuits happen, legal battles. We have to go to court and actually show these in a court of law. So they must be complete, they must be detailed, and it's confidential. So if you know anything about HIPAA laws, HIPAA rights, that means that we can't go and say that client or patient's name. I'm not allowed to mention them to people outside of the practice. You might have stories that you really want to tell, and that's great. Censor the patient and the client's name. Never tell somebody their name. You don't know who's connected into what circles, and you could definitely get yourself in a sticky situation, especially if the animal is a breeding animal worth a lot of money, and now people know that they're sick and in the hospital. That could be a huge issue. So rule of thumb, everything needs to be kept private. Treat it just like you would with humans' medical records. We're not saying names, we're not giving out information. And again, you can share information with your friends and family, but just be very vague. I'd say a Shih Tzu came in. I wouldn't say Dolly Parton, the Shih Tzu. Like, I wouldn't go into those type of details. But I can still share what I went through during my workday. Just be aware, be censored with your information that you're giving people. We will have all of these entries. Again, they're going to be confidential and they're locked records. So once they have their appointment and we've seen them, or they're hospitalized, whatever, it's usually 3 days after the appointment or the discharge that the records will be locked in. That means that you can't go in there, you can't delete them, you can't edit them, you can't do anything to them, because we don't want anybody to, of course. So if they needed to be addended or to be changed, a manager can come in to come change it, or a doctor can. But for the most part, it's going to be locked in as that record. And owners, it's really important. Owners do not own their patients' medical records. The practice does. So they are allowed to request a copy at any time, and we can give them a copy at any time of these medical records, but they are owned by that clinic. Now, that also being said, we're not allowed to just give these documents to anybody. It has to either be the owner that's on that account or somebody that they've already signed off and consented to have those records. We're not even allowed to give the records to other clinics without the consent of the owner first. So there's a lot of legal issues and hoops that we have to jump through. And again, keeping this information as confidential and private as possible. If we do have to correct a mistake on the record, if it's a paper record, you may come into contact with them. Rule of thumb is to just take the pen and to take a line and go right through that sentence that you wish to take out, initial, off, and date, and then write what you need to. There's no whiteout. You can't take any white or correction fluid to go over a paper record. Take a pen, exit out, and go forward and write what you meant to. A little bit easier with digital records. We can go in there and change and addend what we need to. But again, they're owned by the practice, not by the owner, but we can give them a copy at any time. Also, that also ties into the fact I'm not allowed to tell somebody if someone calls and asks, does Ruby Davidson have an appointment with Fluffy, tomorrow? I would have to ask who's calling, why, and try to get to the bottom of, is this their husband? Is this their child? Who's trying to remind them? Because if I give this information out to just anybody, I don't know, it could be an abusive partner or an ex or family member that has no rhyme or reason to know about this information. So if they're not on the client's records as somebody that can know about the patient's information, they don't get to know anything. Nada, nothing. Just be aware of that, you guys. Okay, getting into the medical records format, we use problem-oriented medical records, also known as POM-R, and we use this through a progress report called the SOAP, which stands for Subjective, Objective, Assessment, and Plan. So when we have the patient's medical records in an electronic document, we're going to have a few different options when we're accessing this record. It's going to be within that defined database. They're going to have a master list of problems. So if they've come in for ear infections, if they have an extra toe, if they have, corneal problems with their eyes, anything like that, it's going to go on a master problem list. They've had this problem before, and we can check back on it. The plan, of course, what are we doing today? What are we doing moving forward? And that also goes into our examination protocol, which is using SOAP. So we will use subjective and objective as the assistant or technician for the room. Why are they coming in? The reasons for that, background, history, and vitals. The doctor will come in, do the assessment, which is the exam, and then the doctor will write out a plan, which is where we're going to get all of the information to make our estimates for, be able to get it signed off on, and then we will initiate the plan. We'll go forward and start to do the treatments in the plan, but the doctor, they'll be the one that makes it up. We don't have to do no guessing games there. They'll tell us exactly what they would like to do. Okay, now standard operating procedures, or SOP definitions. So these are protocols that we'll have within the hospital, whether this is employee manuals, MSDS, which is material safety and data sheets, or just any other SOP procedural protocols. It's going to be stored in a central location in the hospital. So it could be your manager's or doctor's office, but there will be a home place for all of these protocols, even technician manuals that we might need for the hospital. Getting into our last section for today, this is inventory management. So as I said before, it's usually going to be a technician or a receptionist in the hospital that is in charge of inventory, and they will be going through everything that's in the hospital. So they'll have a certain amount that we need to have in the hospital. They'll go through, they'll count everything, and then they'll make a reorder form for all of that. So the reason to have somebody in charge of inventory is because inventory is a huge expense to the practice. We spend so much money trying to order medications and parts for surgical things, pretty much anything that you would ever need in the hospital, we're going to be ordering and is in charge of by that inventory management. So we have to really be careful about what we're ordering or not ordering. This goes under economic order quantity, or EOQ. This is going to prevent us from over purchasing or under purchasing or even impulse buying certain things for the hospital. So we'll have a budget that we have to stick to. And again, we usually have a protocol of, there needs to be 3 bottles of Serenia in the hospital, 2 of Convenia, and whoever's inventory will double check that, make sure if we have any back stock, and just reorder as we need. We will do orders for the hospital sometimes once a week, sometimes once a month. It really just depends on how they run their inventory. And we will do an annual inventory report every single year, and everything should be updated and put into the computer. So there should be a computerized inventory control. That's going to be the easiest way to keep up to date on everything that's in inventory, because there's so much going on. I have seen it in paper form, but it can get really messy really quickly. So it's better to be even like an Excel document as an inventory control. Now, to give you an example here, this is just a picture here, snapshot of a pharmacy at a hospital. So a lot of medications, you guys, and that's just one section of the pharmacy. So there's so many different medications we have to count and be considerate of. So when we are pricing our products, we're not going to price them at wholesale at what we buy them at. They will have a markup to them. The reason for the markup is the dispensing fee, and also if there's a minimum prescription fee. So let's say the prescription needs to be more than $5. There's a minimum prescription fee. So if it's under that, we might charge a few dollars, as well as the dispensing fee. We have to pay the technicians or the assistants for their time. We have to pay the inventory management for their time and for their dispensing. So sometimes it's like an additional $5 to $7 for a dispensing fee. So it is a little bit more expensive to get it from your veterinary hospital. I always like to give my business to the hospital though. If I was going to give my money and pay for something, I'd want to give it back to my veterinary field, not to big pharma like Rite Aid and things like that. I'd want to have it filled through my vet hospital. And that's just my personal opinion. But that's why it is a little bit higher, is because they do take into effect dispensing and minimum prescription fees. Now, we will label prescription items depending on what bottles that they come in, boxes that they come in. You can see a lot of these have writing on them, you guys. They have check marks or writing. So if they're open, they're going to have a big check or big X on them saying, I'm open, don't prescribe out the whole bottle because I'm missing tablets, I'm open. And then there's dates written on here as well. So we're going to write the expiration date in big numbers on the bottle so that we know when it does expire. It helps us keep track of things. I can see it at a glance versus having to go finding that expiration date on the bottle. So we can definitely label them accordingly and how we need to in the hospital. And that's going to be it for our lecture today, you guys. So again, that's going to be the beginning of our chapter 2. Just going to stop the recording here real quick.